8 top vitamins that can help restore your hair loss. Many people believe that having hair that appears to be healthy is a sign of both health and beauty. In addition, just like every other part of your body, your hair is dependent on a wide range of nutrients in order to flourish and look its best. The most important factor for healthy hair growth is a healthy diet in general. It is possible that taking certain supplements such as vitamins B, C, and D, as well as iron or vitamins specifically formulated for hair growth, could be helpful. Even though age, genetics, and hormones are also factors that affect hair growth, maintaining a healthy nutrient intake is essential. Rapid weight loss, hypothyroidism, and iron deficiency are all potential causes of hair loss. In today's video, we will discuss some vitamins that have been shown to stimulate hair growth. Let's begin. 1. Vitamin B. A large number of young people are experiencing hair loss, regardless of the cause. Genetics, hormonal imbalance, stress, or poor hygiene, the absence of any essential nutrients, most notably vitamin B, is the most likely explanation. It is normal to lose between 50 and 100 hairs every day, according to both dermatologists and hair doctors. Your hair goes through a never-ending cycle of growth, repair, and shedding at any given time. Ensuring you get enough of the B-complex vitamins is important for keeping your nerves healthy. These are vitamins B1, B2, B3, B5, B6, B7, B9, and B12 respectively. If you are lacking in this group of nutrients, the first thing you should do is eat more natural foods. Your go-to foods should include things like avocados, beans, eggs, fish, liver, poultry, whole grains, and green leafy vegetables. If you maintain a diet that is nutritionally sound, you won't have as much cause for concern. There is no risk of toxicity associated with vitamin B, in contrast to vitamin D. B-complex vitamins are water-soluble. Your body will only use the amount of vitamin that it requires, and any surplus will be eliminated through your urine. If you depend on a diet that is primarily plant-based or are taking a certain medication, you should not be afraid to take this supplement. Biotin. This nutrient is also known as vitamin B7. This B vitamin is well known for its ability to make hair stronger. It has been demonstrated through a number of studies that having low levels of biotin can speed up the process of losing your hair. It aids in hormone synthesis and red blood cell production. Along with that, it helps hair papilla cells grow and brings more blood to hair follicles. With biotin, your hair will get stronger and feel better. Although it is in the water-soluble group, this is the only vitamin that your body can store in small amounts. Biotin is secreted by the gut flora and stored in small amounts. According to a few studies, a lack of biotin was present in 37% of women who had experienced hair loss. Those who are already deficient in vitamin B7 may greatly benefit from taking this vitamin because of its ability to make up the difference. Remember that there is no evidence to suggest that taking biotin supplements will help people who already have healthy levels of vitamin B7. A daily consumption of 30 micrograms is the amount that is suggested for adults. Vitamin B12. If your body does not have enough B12, you will experience fatigue. You run the risk of losing your hair as well. You need to take in about 2 micrograms of vitamin B12 on a daily basis, not only to maintain your health, but also to ensure that your hair looks its best. Pregnant women and mothers who are still nursing have a daily requirement of about 3 micrograms. Despite the fact that some medical professionals have faith in this magic vitamin, research has shown that there is no correlation between B12 levels and thinning hair. Nevertheless, increasing the amount of B12 in your diet won't hurt at all. 2. Vitamin D. There is an extremely wide range of conditions that cause hair loss in today's society. Alopecia is one of these conditions, which is known as an autoimmune condition. According to one review, A lack of vitamin D has been suggested as a possible link between this type of hair loss and the condition. A pre-existing deficiency in vitamin D can make the symptoms of alopecia even more severe. One study also found that low levels of vitamin D were linked to the typical pattern of female pattern baldness. It is possible that it will begin with the part in your hair becoming more noticeable or with thinning hair around the temples. In most cases, blood work is the first diagnostic step taken when a patient presents to the doctor with hair loss complaints. That should give you some idea of the amount of vitamin D in your system. Vitamin D intake of 600 international units or 15 micrograms per day is recommended for adults who are healthy. Even if your vitamin D levels are low, this does not necessarily mean that you will need to take vitamin D supplements for the rest of your life. Your primary care physician will most likely start you on these dietary supplements for a period of 12 weeks before performing a follow-up evaluation to determine whether any adjustments are necessary. In addition to taking vitamin supplements, you may also get this vitamin from its natural food source, which is considered to be the best source. Fish, mushrooms, egg yolk, and other foods like orange juice and milk that have been fortified also fall into this category. Exposure to sunlight increases the natural production of this vitamin within your body. Remember to apply sunscreen before venturing outdoors. Overexposure to the sun is harmful to the skin. Insomnia, muscle fatigue, weakness, and hair loss are all potential side effects of vitamin D deficiency. The vast majority of dietary supplements will contain vitamin D3. You need to exercise caution regarding the amount of vitamin D that you take in on a daily basis. Even though vitamin D toxicity is relatively uncommon, it can still result in serious complications. A dose of 50,000 international units, which is considered an excessively high amount, can be harmful to your body. One useful piece of advice is to consume foods that are naturally high in fat, along with vitamin D. Because of this, the vitamin is absorbed into the body more effectively. If you take in excessive amounts of vitamin D, you might experience nausea, weight loss, disorientation, and problems with your heart rhythm. 3. Vitamin A. The growth of hair cells is the most rapid of any tissue in the body. Because of this, it makes sense that vitamin A is the best fuel for that growth. A lack of vitamin A can cause your hair to become unmanageable, dull, and unruly in appearance. By assisting in the production of sebum, it helps to maintain the suppleness and softness of your hair's roots. This is the natural oil that keeps your tresses from becoming overly parched and brittle. Supplements of vitamin A, also known as retinol, are readily available. However, you should make sure to consume them in their natural forms by eating foods like fruits, vegetables, oranges, pumpkins, sweet potatoes, and cod liver oil. Keep in mind that you need to take this vitamin at a more leisurely pace. Vitamin A intake should not exceed 700 micrograms per day for women and 900 micrograms per day for men, according to the recommended daily allowances. 4. Zinc. Zinc stimulates hair growth and ensures that the oil glands that surround the hair follicles continue to function normally. Zinc is considered a trace mineral because the human body only requires very small amounts of it. Although it is tiny in size, its impact is significant because of the role it plays in cellular differentiation and DNA synthesis. It is possible to experience hair loss if you do not get enough zinc in your diet. Those who consume an excessive amount of alcohol, those who suffer from Crohn's disease, pregnant or breastfeeding women, and those who have chronic kidney conditions are more likely to develop zinc deficiencies. If you struggle with hair loss or thinning, it is also worth talking to your doctor about the possibility of taking a zinc supplement. Your doctor will be able to determine whether or not this is the best treatment option for you. Patients with alopecia who have a low serum zinc level should receive zinc supplementation according to the findings of a small study. Zinc can be found in moderate amounts in many commonly eaten foods, including beef, spinach, pumpkin seeds, oysters, and lentils. 5. Vitamin E. This vitamin, which is fat-soluble, can shield the cells of your body from the damaging effects of free radicals and oxidative stress. These harmful particles, called free radicals, can damage your DNA, RNA, and the way your body makes proteins. This vitamin not only improves the blood circulation in your scalp, but it also helps prevent hair loss and stimulates the growth of new hair at the same time. Vegetable oils, nuts, green leafy vegetables, and fish are the best foods to eat for getting vitamin E. Research has shown that people who take vitamin E supplements in moderate amounts experience an improvement in their alopecia condition. If you are going to take supplements, the recommended daily allowance is 15 milligrams, and this is the amount that you should take. 6. Vitamin C. Oxidative stress is a major factor that contributes to hair loss and should be avoided at all costs. This takes place when there is an imbalance of free radicals and antioxidants in our bodies, which can lead to an electron imbalance, which in turn could result in hair loss. Consume more foods that are high in vitamin C to solve this problem. Antioxidants in your body can reduce the damage caused by free radicals to your hair by restoring electron balance. Vitamin C helps your body absorb iron, which can stimulate hair growth and also aids in the production of collagen, which delays graying of the hair. If you smoke, consume excessive amounts of alcohol, and eat an unhealthy diet, you may develop a vitamin C deficiency, which can result in hair that is twisted and kinked like corkscrews. Vitamin C, which acts as an effective antioxidant, is absolutely necessary for the growth of healthy hair. Increasing the amount of vitamin C in your diet can help improve blood flow throughout your body, including your scalp. If there is an increase in blood circulation to your scalp, your hair follicles will be stimulated more, which could potentially help promote hair growth. Vitamin C is found in abundance in red bell peppers, leafy green vegetables, and citrus fruits, among other foods. Vitamin C supplements are essential if your diet does not provide enough of the nutrient. The recommended daily allowance for vitamin C for adult men is up to 90 milligrams, while the recommended daily allowance for adult women is only 75 milligrams. Heartburn, muscle cramps, fatigue, skin flushing, and even the formation of kidney stones are possible side effects of taking excessive amounts of vitamin C. 7. Iron. Hemoglobin is a protein that is found in the red blood cells of your body, and the production of hemoglobin requires iron. These cells transport oxygen to other cells throughout your body, assisting in the maintenance and development of those other cells. A lack of iron can cause hair loss, and women are more likely to suffer from this condition than men. Eggs, red meat, lentils, spinach, oysters, and clams are some examples of foods that are good sources of iron. The amount of iron that should be consumed each day is 45 milligrams. Bear in mind that consuming an excessive amount of iron can lead to gastrointestinal discomfort, nausea, and even vomiting. If you are at risk of iron deficiency, it may be worthwhile to add an iron supplement to your routine. However, you should first consult with your primary care physician. 8. Other vital nutrients for hair health. 1. Keratin. Proteins are the fundamental elements from which your body is constructed. Without protein, growth in the body and repair of damaged cells are simply not possible. Maintaining healthy tissues will help prevent the unwanted loss of hair. Keratin, which is a type of protein, is primarily found in our hair, skin, and nails. If you don't have it, you won't be able to make new hair cells. It will also be very difficult to maintain the ones that are already there. The body naturally produces the protein keratin, and there are a lot of dietary supplements on the market that promise to encourage hair growth. However, rather than taking a supplement in the form of a pill, it is recommended that you consume keratin in a more natural way by eating foods that are high in protein, such as eggs, beans, fish, and meats. 2. Magnesium. Additionally, magnesium is required because it plays an important role in the biochemical reaction that occurs in your hair. A lack of magnesium can lead to fatigue and hair loss in some people. Magnesium can promote the growth and development of hair follicles, which are the structures in charge of producing hair. A magnesium deficiency can inhibit the growth of hair follicles, which can result in weaker and thinner hair. 3. Omega-3 fatty acids. You need to place a particular emphasis on omega-3 fatty acids. You might be able to obtain it from natural sources such as salmon, oysters, cod liver oil, flax seeds, walnuts, kidney beans, and other foods. Many people take fish or fish oil supplements in order to stimulate hair growth and prevent hair loss. This suggests that the omega-3 fatty acids found in fish oil provide essential proteins and nutrients to hair follicles, prevent hair follicle inflammation, which is a factor that can directly contribute to hair loss, and help promote circulation in the scalp, which may trigger hair growth. When you should see a doctor about your hair, even if it seems like a lot, losing anywhere from 50 to 100 hairs per day is perfectly normal, as we previously stated. The average person loses about 100 hairs per day. The loss of hair is a common side effect of aging that affects many people. Having said that, there are circumstances in which a visit to the physician is warranted. It is strongly suggested that you consult with a dermatologist who is board certified to discuss the various options available to you. Receiving treatment for hair loss at an earlier stage can help reduce the amount of hair lost overall, while also increasing the effectiveness of the treatment. During a consultation for hair loss, a physician can take detailed notes on your family and medical history and perform a physical examination of the hair and scalp to determine the cause of the condition. It is possible that blood work will be taken and then sent to the laboratory in order to determine whether or not there are any abnormalities that are contributing to the hair loss. In addition, a scalp biopsy or a hair sample might be collected in order to further investigate the factors that are contributing to the hair loss. The effects of hair supplements do not appear immediately. It could be several months before you see any signs of improvement at all. Keep in mind that a number of variables, such as the cause of your hair loss, your diet, your genetics, and other aspects of your situation, can affect the success rate. We have discussed the many vitamins and minerals for hair growth, but as we know, our daily diets play a crucial role in maintaining our overall health. If you are looking for more food-related videos, here are a few more we recommend you check out. Watch 40 superfoods that have almost no calories, or try 14 healthiest foods with almost no carbs and no sugar. Go ahead, watch one or even better, both. Do you suffer from hair loss? Tell us in the comments section below.